The member for Cambridge.
Mr. Speaker, my question is for the Minister of Health. The rhetoric of this government in handling COVID-19 is alarming and sinister. Months ago, this government could have taken decisive action. They could have pushed the Prime Minister to shut the borders immediately. Instead, they dithered, choosing instead to campaign and pal around with the Prime Minister while putting in place ever-changing half measures and intermittent lockdowns without the data to back up their decisions. They blew it. And now they blame and threaten the people of Ontario. On October 9th, the minister's press release stated that regional lockdowns were necessary to, and I quote, avoid the need for harsher measures in the future. 4 days ago, the Premier said he was ready to, and I quote, put down the hammer on Ontarians. Will the minister please tell us what other hammer-like measures this government has in store for the people of Ontario?
Thank you. Minister of Health to reply.
Thank you very much, Speaker. Well, there's a lot to deal with in this question, but what I can tell you is that we have taken every step that we've needed to take throughout this pandemic. We've never faced anything like this in Ontario before, and we've taken measures as we saw the rise in Wave 1. We took the measures that we needed to take, and we were able to get the numbers down under control to below 100 for several weeks in August. The number of cases have continued to rise, and we are taking an appropriate look at how we need to deal with it, with bringing modified Stage 2 levels to Ottawa, Peel, Toronto, and now York Region. We don't want to lock down the entire province. Nobody wants that. People need to earn their livelihood. We are taking the steps necessary to make sure that we can protect the public and make sure that we can also protect the economy. Those are steps that need to be taken. We are taking very careful measures based on opinions, recommendations, advice that's been given to us by many experts.
Thank you. Supplementary question.
Thank you, Mr. Speaker. Case data from the past week shows the intermittent regional lockdowns have no correlation to an increase or decrease of COVID cases by region. If it worked, for the last week, we should have seen the regions where lockdowns were not imposed, making up for growing increase in the share of total cases. Over the last week, Peel saw its share of total cases increase from 16% on October 9th to 23% on October 18th, and Ottawa saw its share of total cases stay the same. During the same week, the total COVID cases from the areas not included in the 3 locked-down regions decreased from 327 to 212. Will the minister finally admit that these measures, shutting down businesses, are not controlling any increase or decrease in cases, and will this government finally end these intermittent lockdown measures?
Speaker, first of all, through you, Mr. Speaker, I need to remind the member that the numbers that you see today don't necessarily reflect the actions that we took only several days ago. It is during a period of incubation that we have to receive these numbers, that they are increasing in these locations, and the measures that we bring forward based on the advice we receive from the Chief Medical Officer of Health, Dr. Williams, from the Public Health Measures table, from the other tables that are involved, including the mental health table that gives us advice, tell us that we need to first of all look at the number of cases in an area. We also have to look at the public health response, the ability of public health to respond, the ability of our health system to respond in terms of hospitalizations and places of care for people in long-term care hospitals and retirement homes. And then we have to look at the community transmission.
Response.
We are looking at all of those issues as we make these decisions, and we want to make sure we take a measured, careful approach that protects the health and safety of the people of Ontario first.
Thank you. The next question,